you can see a path forward where a combination of a very substantial expansion in coverage, a significant improvement in the healthcare system, and from that I mean the transformational steps that we've been discussing, and it being at least deficit neutral and helping to put the nation on a sounder fiscal path over the long term, are all feasible. We acknowledge that those out-year deficits were higher than desirable. That remains the case. We're in the midst of, in fact, a lot of my time is now being spent on the fiscal year 2011 budget process, which we're in the midst of internal processes on. And what we have said is, as part of that fiscal year 2011 budget, we will be putting forward proposals that return us to a fiscally sustainable path and that have lower deficits in the out years than in the mid-session review. But just like I'm not going to sort of pre-negotiate a conference agreement on healthcare here, I'm also not going to fast forward to exactly what will or won't be in that budget, other than to say we recognize that the out-year deficits in the mid-session review are higher than we want, and there's going to be additional proposals put forward to reduce them.
But do you think there's a way to credibly do it only by cutting spending and not raising taxes?
I'm not going to get into the mix between spending and revenue. Obviously, deficit reduction requires some combination of those two. I mean, I'm just speaking from an arithmetic perspective at this point. Some combination of reductions in spending and/or increases in revenue. But you're going to be able to evaluate the proposals we put forward in February.